Now let's talk about the supine position. The supine position, the client will lie on their flat on their back, right? And it is used for clients with spinal injuries or after surgery. And clients should be log rolled to maintain spinal alignment. So don't move the patient in this position alone. Make sure you have other people to help you so that you can keep a straight back and then log roll the client. This position increases the risk of pressure ulcers on bony prominences because there can be a bony prominence here, behind the thigh, on the buttocks, even at the elbow, right? So all these are areas where they can develop ulcers from, on the back of the head, the elbow, the buttocks, the heel. So you want to also be wary of that. But remember that we use it in clients with spinal cord injuries and after surgery. What about Trendelenburg's position? In Trendelenburg's position, it's like the supine position, but the feet are higher and the head is lower. Okay, so you tilt the bed. And why do we use this? Just think about it. If blood flow to the head is low and you want blood flow to go to the head, so you want to tilt the bed so that the legs go up and the head comes down. So in patients with shock, with hypotension, in patients who have prolapsed umbilical cord, because if the patient is pregnant, the umbilical cord has fallen out, the head of the baby is about to press on it. You want this position so that it reduces the pressure on the umbilical cord. And then we also have the reverse Trendelenburg. This time, the head is higher and the feet are lower. And we use the reverse Trendelenburg. Remember that the Trendelenburg was to get more blood flow to the brain. The reverse Trendelenburg is to reduce blood flow to the brain. So it is to reduce intracranial pressure and to reduce blood flow to certain areas. All right. So Trendelenburg is to get more blood to the brain. Reverse Trendelenburg is to reduce pressure in the brain. All right. I hope you are learning something nice today. I hope you are learning something nice today. I hope you are learning something nice today. So reverse Trendelenburg, we've learned what to use it for. What about orthoponic tripod position? So the name even speaks for itself. It's a position which the client is sitting, okay, and they are on the bed or they are sitting on the side of the bed, and there's an overbed table, and they are leaning on it, and they may have several pillows because the patient may have shortness of breath. The patient may have pulmonary edema, and you don't want them to, you know, um, uh, uh, you don't want them to sink in their own fluid. And then we also have the SIMS or the semi-prone position. The patient assumes the posture halfway between lateral and prone position. Okay, remember the lateral position, they are lying on the one side, either the right or the left. Prone position, remember that they are lying on their face, right? And on their tummy. However, the SIMS or the semi-prone position, the client is not lying totally on their belly, and they are not also lying totally on their lateral side. And the lower arm is positioned behind the client, and the upper arm is flexed. Okay, at the shoulder and at the elbow, the upper leg is more acutely flexed at both the hip and the knee than the lower one. So I just want you to imagine it. I just want you to have it in mind so that you know exactly what these positions are. So you know exactly what these positions are. Okay. So because if you know what these positions are, it helps you in the exam. You can be able to remember. You can be able to do what you need to